we can't use any kind of sleep medication with you. So you're going to have to try to get your insulin adjusted a little better so that those nighttime fluctuations don't bother you quite so much.
On one of her regular visits to Dr. Bonano as part of her treatment for type 1 diabetes, Lynn Nijak of Bayshore reveals how the prescribed insulin has an effect on her nighttime sleep pattern.
Are you napping during the day? Does that affect your sleep habits at night?
I don't nap during the day, but I realize like at night that my blood sugar will be very high, and then if I adjust to the insulin ratio, then it'll just drop, and then it takes forever for it to come back up. I feel like I'm always playing catch up.
Yeah.
So unfortunately, that's one of the side effects to having type 1 diabetes, is that it can cause some insomnia. Plus I have other autoimmune diseases that also can contribute to sleeplessness or oversleeping. You know, it's never steady.
Type 1 diabetics lose all their insulin production eventually, whereas type 2 diabetics have insulin production right on through most of their life. We have been developing some new diabetic medications, which are also very expensive, that do not increase the appetite. And I think that's one of the future directions that the research in diabetes is taking, to postpone people from needing insulin and using some other medicines which may control their blood sugar and reduce their complications without adding weight.
For Nijak, a visit to the doctor 9 years ago for what she thought was a stomach flu was diagnosed with type 1 diabetes, the most common form of the disease where the body does not produce insulin. Her organs were shutting down, and she wasn't expected to survive the rest of the night.
They told my husband they weren't expecting me to make it overnight, and that became my whole new reality.
She almost did not survive diabetes. She didn't pay attention to the early warning signs that are there.
The most common early warning signs are increased hunger, fatigue, frequent urination, and increased thirst. Healthy Living consultant and Push Pause contributor Margaret Marshall paid a visit to Dr. Bonano to discuss the latest approach to physicians to diagnose diabetes in its early stages for people who are in risk categories, who have a family history, and the latest form of prescription drugs, such as insulin.
Our goals in the early stages of people we're taking care of who are at risk is to work on their diet and their exercise and activity level. That's where we have to start. I mean, when people develop overt diabetes, they have to do more than that sometime with medications, but that's the preventive strategy that we have to depend on with people who are at risk.
What are some of the complications? What do people suffer when they go into diabetes?
Diabetes, just its presence, makes you at higher risk for heart disease. And that isn't as directly related to the blood sugar control as it is to some other contributing factors that diabetics have.
It matters what you eat. It matters that you exercise. And I will tell you, once you're diagnosed with diabetes, and if you get to the point where you're insulin dependent, it's very difficult to lose weight. Right, so what I say to my clients often is that get into the habit of that healthy lifestyle. Start making those changes as early as you can.
Type 1 diabetes is also known as the insulin-dependent diabetes because this type always requires insulin treatment.
How is one's life managed when they have to be insulin dependent? Is that difficult?
The types of insulin we have now are much better and more effective than we used to have, and some people need insulin pumps, right, and long-acting or multiple insulins. But I'm sure most people would agree giving themselves injections, whether it's once a day or 3 or 4 times a day, is not a pleasant task. You also have to monitor your own blood sugar.
Yeah.
Diabetes is a lifelong condition whose symptoms you can control with the proper medication and diet. Consult your physician for more information.
So what he said that was most important for people to hear, including myself, is that the longer you can ward off a diagnosis of diabetes, the less the chance of the severe complications from that disease.
For Push Pause in Bayshore, This is Archie Snowden.